April, you've mentioned the role your mother had, the 12-step program that you joined, how the impact of other nurses speaking up has helped you. But you've also said a few times that you noticed you were spiritually empty and that you had to refill. And I think this journey of recovery is a physical, an emotional, and a spiritual one. And I'm wondering if you can say a little bit more about how that has helped you in your recovery journey.
Yeah, just like we're learning that there's an alternative to discipline for nurses, there's an alternative to shame. And learning that I'm April 1st and then a nurse next. I walked into a recovery program and they said, "Who are you?" And we had to go around in a circle and say who we were. How did we define who we were and to share that in the group? And there I was, I am a nurse. That's what I said. And I mean, I was very, very, without even thinking about it, that's what I said in that group that day. That was a Friday. And when I went through this recovery for healthcare program, it was a weekend program. And when I came out on Sunday, I left April again. And that transition of finding out who I spiritually am and really how I am defining myself and what would it look like in a world without a nursing license? What does that actually mean to me? Was really what I needed to figure out, and then I could start letting the promises and the miracles of recovery into my heart. And I've mentioned it before, but my primary group is Alcoholics Anonymous, but it's not a substitute the for something. It can't be one or the other. It for me and what Kristen and I are finding in the work we do and in the literature that we know of is it's that combination of a nursing peer support program with a recovery of choice that really helps you fill your spirit back up and get the resources and the knowledge that you need to keep going. And if any nurse hears this today, and if you're suffering alone, to just know that there is help out there in new ways that you might not think. I dedicated my project. I can give an example of some areas in healthcare organizations here in Minnesota that have stepped up their game through the employee assistance programs and a wellness page. On a wellness page, for one healthcare organization, it talked a lot about weight loss and it talked a lot about smoking cessation and an apple a day keeps the doctor away and how you can exercise and eat better. And my project for my DNP, I was able to bring the links to that page for nurses that were working for that organization to get the help that they need if they had a substance use disorder. And just getting it on a website, just putting it in front of people, was a huge step to getting nurses that spiritual help that they need and that physical help that they need. And it's just, Marie Manthe used to call it laying the crumbs along the way for a suffering nurse to pick and see the path to recovery and spiritual wellness. And that's what Kristen and I are trying to do, is lay a pathway of crumbs for you so that you know that there is a better way to live and a better way for your spirit to thrive in this world.
And you both are definitely doing that as advocates. I mean, sharing your story here as testament of you speaking up for other nurses in doing that. Kristen, I know you've been very involved in your own hospitals as well, trying to make people aware of something very practical, which is just the exposure that they face daily to dangerous substances and putting those safeguards and protocols in place. Could you maybe share a little bit more about that?
Yeah, of course. Excuse me. So I think the first thing is education. I think nurses, but not only nurses, people that work with nurses, and nurses truly are not the only people that are exposed to dangerous substances at work, physicians, pharmacists, pharmacy techs. So really all folks whose job is to administer or prepare medications, controlled substances in particular, need education. Education on the substances, that they're dangerous, that they're at increased risk, that they need to make sure and follow protocols so that they and their colleagues can be safe. That the signs and symptoms, educating on how to recognize when a peer may be struggling. What does substance use look like in a peer? Like I'm like April, a very high functioning, an excellent nurse, never had a bad review until I was diverting and was miserable at the end, had never had any issues at work. So what does it look like when a strong nurse is using, especially at work? What does that look like? And then what to do if it's suspected, if you have a peer that you're concerned about. What do you do? How do you, number one, get up the courage to say something? Who do you say something to? How do you do that? I think education on all of those things is really important, yearly, not just a one time and okay, now we can move on, we've checked that box, but every year just updating people like this is just a reminder, this is an issue. I think it's really impactful to include a story of a person like April or like me that has gone through the experience. It makes it more real. It makes it memorable, other than just clicking through a PowerPoint of slides on statistics and policy. It makes it more memorable. And then I will tell you that my diversion began through that wasting procedure or lack thereof. And it was allowed to continue for about 3 years because of that lax wasting procedure that we had at the hospital. Now, as I mentioned, everything was on paper back then, and now we have these fancy, a lot of us anyway, have fancy machines. So it certainly is better, but it is not an absolutely a process that prohibits diversion by any stretch of the imagination. We need to be very careful about adhering to the wasting procedures in our hospitals or clinics, wherever you are. I encourage friends, peers, coworkers to watch each other as they are wasting controlled substances, and not just to put their credentials in the machine and walk out of the room, leaving the nurse there with the extra medication as well as the dose for the patient. If you're familiar with that wasting procedure, typically what's supposed to happen is 2 staff will go to the machine that gives you the medication, will log into the machine, take the medication out, and then you will remove what medication you need for the patient, and then waste the remaining medication or dispose of it. At the place I work now, I work in an emergency department again, we have a solution that we squirt it into and it neutralizes it. And then the nurse that has witnessed it will go back to the machine and put their credentials in, acknowledging that they did watch the waste, and they will leave. Often what happens is that person that witnessed, without watching the nurse do the wasting procedure, will just put their credentials in and leave. Again, leaving that nurse with the full dose. It's just really dangerous. Like that is where diversion happens in that moment. And so I encourage, the people I work with know my story. I'm very open about it. So they know that I will expect them to watch me waste when I ask them to do so, and that I will watch them. And I think that has really helped that process. So being very cognizant to follow that procedure, I think is so important. It keeps us safe, but also our peers. You're doing it for them. You're doing it to keep them safe. Although it's a little uncomfortable to stare at somebody while they're doing, their wasting procedure. Make small talk. How's the weather? It's terrible here in Wisconsin. Lots to talk about there. And then another thing I would point out is, we, in our ER, we used Dilaudid frequently. It's a pain medication, an opioid. And often our doctors, or not often, they always order 0.5 milligrams. Like that's their dose. And the only syringe we had available to us was 1 milligram. And we probably give Dilaudid a handful of times every shift. Like we're giving it all the time. So we were having to waste a 0.5 milligram every time we gave that medication. Even if we knew the patient was going to need the second half in half an hour or an hour, we still had to waste it because that's our procedure. So I said to my manager, I said, is there any chance of getting like a 0.5 milligram syringe? I know they make them. I looked it up online. She's like, oh, I don't know. Let me ask the pharmacist. So the pharmacist was like, well, yeah, sure, we can stock that. And within a week, we had the 0.5 milligram doses stocked in our Pyxis. All it took was me asking the question, which it didn't occur to me right away. It took me a long time to realize, why don't I find out about that? So we can do things like that too as nurses that are responsible for those meds. We can, do that, those kind of things to make our work environment safer for us and our patients.
So many practical and useful things there. And like you say, some of them aren't even easy. It's just asking the question. April, I want to ask you about, you mentioned a little bit around how we can better prepare students before they enter the workplace. And I'm wondering if you have any other suggestions of how do we make future nurses aware of the risks, or even just teaching them how to share their emotions. What would you suggest for the next generation?
Oh my goodness. First of all, I want to say when I was a nursing student, I was drinking so heavily, but it wasn't as severe of a problem yet. I was younger, I was stronger, everybody was kind of partying. But I've said it before, there was nothing in my curriculum at school to teach me about the way I felt about what was going on or what I was doing as a behavior with substances, particularly alcohol, with my alcohol use disorder. There was really no information. We were just kind of in the wild out there trying to raise ourselves or raised by wolves in nursing school. And so what I ended up doing is dedicating again another part of my DNP project to reaching out to universities and to other nursing schools to talk more about what are you guys talking about in your curriculum when these new fresh nurses in the 2 and the 4 year programs are just new to the nursing profession. What are you talking about in your class time, and what is in your actual curriculum to teach these nurses the risks and the consequences to their own spirit and their own feelings, and then the public safety of those that they're caring for. And really, there wasn't a lot. And so we've made a lot of strides to make that better. The University of Minnesota was one of the first schools that has introduced these concepts within their curriculum, and they have included some toolkits for other schools to adopt, where they're talking about topics such as identifying the signs and symptoms of spiritual bankruptcy, identifying signs and symptoms of potential abuse, like Kristen was doing and like I was doing with my drinking. What would it look like when a nurse behaves in a way that some of these problems are going on outside of the workplace? What does that present like once they get to work? And then understanding the severe stigma and shame that is surrounding all of the things that we're talking today, and what is out there for peer support and other protective mechanisms. The University of Minnesota also initiated a program called Prevention, Awareness, Addiction, and Recovery Reentry, where it's this toolkit, like I said, that can not only help the nursing students where they're at, but they can adopt this, and it gives them things that they can incorporate into their programs, such as educational materials, peer support information, and seeing each other as a person first and then a nurse. I think a lot of times we get caught up in our education at work, we get caught up in our training, we get caught up in the hiring and orientation process where it's focused mainly on the skill that a nurse brings. And to see that nurse as a person first, and then the skill that they bring, and all the things that they need to be whole as a nurse, needs to start in school and then be carried in over into the hiring workplace where they're going to be working.
So you both mentioned the peer support programs that you're part of or that you've started and initiated. And I think, I mean, April, to touch on what you've said, I'm sure that's also a way where nurses can start seeing each other for who they really are. And if it needs to start with us as health workers seeing each other for more than just what we can do. Can you both maybe tell us a little bit more about the Wisconsin Peer Alliance program and then the one you also mentioned, April, and how those programs have been effective and that kind of outcomes you've seen from people being part of those?
Well, in Wisconsin, our Wisconsin Peer Alliance for Nurses, or WISPAN for short, has two arms. The first is how we started, that peer support for substance use issues that nurses are going through. Peer support really being one nurse talking to another nurse, a nurse with lived experience or a nurse that's been through it, talking to someone who maybe is a little newer to the experience and sharing kind of how they got through it and instilling hope and a little bit of guidance can make a huge difference. So we've been doing that now for over 3 years, and nurses tell us all the time. I mean, we have nurses, they come back week after week after week, even after they're done with their monitoring program, because they get so much out of participating. It gives them a sense of hope, and particularly in the beginning, when things are so overwhelming and scary and they don't know what's going to happen. All of a sudden they have a Zoom room, because they're all virtual, a Zoom room full of other nurses that have gone through the same thing. And you can almost see them relax through the course of that hour, where they come in tearful and panicked and, afraid and scared. And then they realize, okay, maybe I can get through this. It's just been so wonderful. But last year we thought, boy, wouldn't it be great if we could intervene for nurses before they get to this point, like before the substance use is such an issue? And so we launched our peer support. We call it for nurse mental wellness. So we also have peer support groups for any nurse that wants support, that wants to come and talk about the issues that are affecting them on a day-to-day basis. And that has been an absolutely incredible group. Just bringing, those nurses that are going through something together and talking with other nurses who have been through similar things. It just gives so much healing, and I think so important. So that piece of it, that peer support or nurses supporting other nurses, I think is a huge piece that we can give to nurses to help prevent the issues to begin with, but then also to help them through the issues if they occur. But we also do education. So much like what April and I are doing here today, we at Wisman are happy to present. I will share my story. I have other nurses who will do the same, as well as education on substance use disorder in nursing. Like, what does it look like? What do we do if we recognize it? All of those pieces, because I think education is just as important as supporting nurses. Like, they have to know what they need support from too. So those two pieces, support and education, I think are the most important.
April, in your program, can you share a bit about that and what's similar from what Kristen has said, and how you've been doing the room you called it, I think.
Yeah. Very similarly, Minnesota has a program just like Kristen was explaining for Wisconsin, where we do all the same things. So I won't repeat that. But what I want to say is, wherever you are in the world today listening, there is probably something going on in your area. You could reach out to Kristen and I, and we could connect you. The deeper into this work that Kristen and I get, we're finding more and more nurses that are in recovery and in need of this work, and we're giving seed support to other states in the country to get this type of work that Kristen just mentioned up and going in their own states and in their own communities. So if your community doesn't have one already, ask us, talk with us. We'll help try to figure out how to connect you to the right resources, because there are so many that we're just not talking about. So the Minnesota Nursing Peer Support Network is very similar, like I said, to Kristen's in Wisconsin, but intherooms.com is what I would like to mention tonight or today, as far as what I am doing in the evenings every Tuesday, 7 p.m. Central Time. All nurses are welcome from around the world, and we are getting together to talk about what's on our mind about nursing and recovery. It has been an incredible opportunity for nurses to show up as they are, or in a way that they don't that they aren't showing face or showing their name. We don't recommend that you hide behind an avatar, but you can if that's where you're at on your journey. No one is exposed unless they want to be, and we're getting together and we're talking about all the things that we've talked about here today. It's an exciting opportunity that Kristen and I have found on In the Rooms, where you're welcome as you are, even if you're a nursing student, even if you are a retired nurse. even if you're still using, but you have the desire to not use and you want to be better, you're welcome there. And if you take this program of peer support and you take an opportunity for some of these meetings that we offer, in person, the Minnesota Nursing Peer Support Network has in person, Zoom, or the online, and then intherooms.com, which I mentioned. If you take just something of that peer support approach and you combine that with, for me, it's AA, but there's NA, there is smart recovery, there's agnostic recovery. There are so many different ways to combine the peer support together, and with it, it's a powerful punch into recovery that we highly, highly recommend, as well as education, of course, and training, as well as resilience and stress management. And there's workplace wellness programs out there now. There's workplace prevention programs. There's employee assistance programs. And then I just have to mention all the nursing professional organizations. Like for me as a critical care nurse, there was AACN, the American Association of Critical Care Nurses. But when you're a recovering nurse, please know that there is the American Society of Addictions in Nursing. There is the International Society of Nurse Addictions at more of a global and world stage. The American Nurses Association has a link to some of the topics that we talked about today. So there's just so much. It's not just peer support. It's a combination of all the things. Pick a couple of them for your own personal self, and then just dive into that, and it will heal you and help you.